Well, good afternoon, everyone. I'm going to be the old school token presenter without a PowerPoint. I actually had one. I presented last week at the Coordinating Committee on School Safety and Health, and I thought of using many of the same slides and decided not to, and it's probably a good thing because as I've listened to the presentations, I've probably changed what I was going to say about 3 times. So anyway, bear with me without the use of graphics. I'm very happy to be here, and I'm always happy to be at the National Academies. I've been on several panels here, and it's just always tremendous to have so many smart, thoughtful people in the room who care about important issues affecting our country. So first, let me say thank you for all of you, the sponsors, the roundtable, the researchers, for all the work we do and sharing a lot of complex information. I know we've used the term in the elevator speech, right? Because there's been a lot of peer-reviewed journal articles, data presented, a lot of complex stuff. When I moved to Washington, I had worked at a school of public policy up in Massachusetts, and I had an internship in a Senate office while I worked for a real job. And I asked a friend who had worked on the Hill, I said, please, just give me some tips. You know, I'm coming from a school of public policy. We like to sit around at forums for 4 hours, discuss research, and talk a lot. He said, Norris, you can have 30 seconds. 30 seconds to discuss a 500-page bill. You need to boil it down into 3 points. And I've been in this town over 20 years, and it's just the way my brain works. I often try to condense, a lot of complex information into 30 seconds. And as I've been listening to the presentations, I thought, what would I tell the senator if he said, Norris, what did they talk about all day? And I boiled it down to this. Senator, education affects health, and health affects education. And you dig into the details and it gets a little more complicated. This is a very, complex topic. We talk about comorbidities and association versus causation, but it's an important dialogue. And as I was preparing for the event, I remembered my first experience at the Department of Education in the Clinton administration. I was focused on workforce development. What I cared about, what my passion was ensuring our public policies ensured that American students and adults were the most prepared, educated workforce in the world. And shortly after I joined in 1993, we released what was called the National Adult Literacy Survey, and this was the day before the internet, the old days where you had press releases, and it got a lot of press. It was big, and it showed some pretty stunning things. A significant percentage of the American adult population had low literacy levels, and the amazing thing about that series is we made it very concrete. When we say they're at this level, what does that mean? And several reports rolled out. One was on civic participation, and the last was on health and health literacy. And that really wasn't on my radar screen, but it made a lot of sense that when you have a low literacy level, health and medical information is rather complex, and this is going to hamper your ability to take charge of your own health. They updated that several, I believe the last was 2007. But, that's just one concrete example. We've talked about many of the effects of low educational levels, but it's important, to remember at the most basic level, if you have a low literacy level after you've completed all your education and you're an adult, it's going to be difficult to understand and be informed and navigate a very complex healthcare environment. So that was my first introduction to social disparities in health and the impact of education and the implications, I moved on to other things. One of the things I would encourage you to do, and the slides I was going to present had some of the findings, but when we talk about schools and health, we thank our colleagues at the Centers for Disease Control, CDC and Prevention, for their SHIPS study. Anyone know what SHIPS stands for? All right, good. Feds love acronyms. School Health Policies and Practices Study. They recently released the 2012 results, so I would encourage you to look at those to just get a real snapshot because it's a cross-section from the state level, local level, and more. And just, you know, a few findings of the things you'll find in there. It said that around 60% of school districts recommended that elementary schools, I'm sorry, required, not recommended, required they provide recess. 32% recommended it. There's a whole list of things they teach, health-related, at the district level and what they require. But it also surveys the number of school-based health centers school districts have, and around 12% of districts have at least one school-based health center that offers health services and mental health. But I encourage you to look at that because that's our federal snapshot, and that's just a sliver of the information in SHIPS. So, you know, check it out on the CDC website. So we thank our colleagues at CDC for that. So what are some of the things we do at the Department of Education that involve the health sector and the health of students? The major investment we have, over $1 billion, is the 21st Century Learning Centers program, also known as the before school and after school program. A lot of academic enrichment happens under that program, but it also provides recreational and movement and fitness activities in the after school space, and also drug prevention activities and violence prevention. So, you know, that's one area people often don't think about where we promote health and wellness. How many of you have heard of the Harlem Children's Zone in New York? All right. So you may know that under the Obama administration, we've used that as a model for the Promise neighborhoods, and we think about all the research and the variables and the factors and poverty and prenatal services and visits to babies, the importance of the first 1,000 days. This is our real effort to drill down deeply, comprehensive from cradle to college and career. And, you know, the administration has asked for substantial funding. That might even be me. Is that me? I've never had this happen. You know, it's funny. I texted all my family. I said, I forgot my cell phone at home, my personal one. Send a text message to my work smartphone. So anyway, I found my personal phone. The Promise Neighborhoods is our big investment. It has a provision on a continuum of services, and that's really the provisions that allow us to really get at health. The other thing we've done recently, and it started in our office, is the Green Ribbon Schools Initiative, which is really a recognition effort. We encourage every state to nominate one school, and it involves environmental impact, but it also involves a healthy environment. So I would encourage you to look at that, and we've really made that a big thing where we elevate those schools. The other thing, and I appreciate the Nemours folks discussing how they used our money really well under the Carol White Physical Education Program, because this is really what I call our innovation fund, where we try to push the envelope with some extra federal resources to allow schools and districts to really ramp up their fitness and nutrition education and promote lifelong wellness among both the students and their families. And, you know, we've got a lot of projects all across the country. We recently made a new round of awards. So the final thing I wanted to mention, because we've discussed vision screening, the importance of that, we have launched a new initiative with HHS called 0 to 5 Watch Me Thrive. And it builds on the experience of vision and hearing screening to move into the area of developmental screening. And we produce all sorts of tools to hopefully help local public health departments, pediatricians, and others get engaged and in the area of doing developmental screening. So that's one of the things I would encourage you to look at and consider. I wanted to also highlight, and I stole Holly's thunder because I was reviewing it on the train, and you can't see it, but it's not released yet. In the next few weeks, CDC is going to release Health and Academic Achievement. And I don't know that we have this award, but I would award this the best graphic design of any publication in the federal government. It's both style and substance. But what it does, it is a resource for people at the local level, both in the health sector and education sector, on messaging, communication, and we've talked about that. How do you make the case that health is important to the education sector? And it's many of the things we've talked about. I hope we can create a buzz because it's not released. I've got an advanced copy, but like I said, I'm nominating it for the best style of any publication in the federal government. And it discusses the evidence in clear, plain English messaging. Things like skipping breakfast is associated with decreased cognitive performance. Deficits of specific nutrients are associated with lower grades and higher rates of absenteeism. Higher physical education and physical activity are associated with improved cognitive performance. And of course, it has the footnotes with all the research, gives core messages at the local level to make the case. And more importantly, because we've talked about this, how do you make all of this actionable? What do you do with all this information? And our colleagues have done us a real service to, by audience, give concrete examples of how you can take action. Now, I will say this is focused on nutrition and movement and fitness, but that is one part of the equation, and this is going to be a real contribution that I think can also be used for the other areas. So I am ahead of my 2 minutes before, and I've got another call. I've got to go turn that off. So perfect timing, but thank you all very much for all you do in this dialogue, and I'm glad that I was able to find my personal cell phone. So thank you.
Thank you, Norris, and thank you for that little promotion there. We appreciate that very much. By the way, we are developing PowerPoint presentations to go with those fact sheets and hope that it will be very useful for schools. Next, we have Laurie. Oh, she's already. Laurie Miller-Broadman. She's ahead of us. Laurie's the director of the Center for Childhood Health and Development at the NYU Lando Medical Center's Department of Population Health, and we've already heard that we should anxiously be anticipating what she's going to share with us. Thank you, Laurie.
Thank you.